Welcome to the It's Your Choice podcast, where we learn how to rewire our brains to live the life we desire. On with the show.
Welcome to It's Your Choice podcast. Today on the show, we have Alain Salas. Thank you very much for joining us today.
Thank you, Sally, for having me. I'm very excited to have a conversation with you, actually.
I'm excited too. So you are from France and you were there living on your sailboat, and one day you had a calling to do something. So let's start there and tell us a little bit about your journey and what happened.
Sure, it's kind of like I was minding my own business, right? They used to call me the gypsy. I used to have long hair, earrings, and free-spirited for sure, and party all the time. And I was the kind of what I call a sun chaser, because when the season was over with in south of France, either I use my boat for a while, right? But after it get cold, so I will buy a airfare and spend months, in the south hemisphere, So for actually 7 years, I didn't know what winter was. So you will think this is the ideal life, right? I mean, why changing? But I just, like you said, I had a calling and I saw myself helping people. And when you got a calling, first of all, there's no doubt you cannot say no, right? You know that you know, right? And so that's very important. So the only problem is like, how I'm going to do that, right? Because there was no, I knew it will be with a healing, healing part, but there was no member in my family who were like even remotely involved with healthcare or healing. So I started to ask my client, right? And one of my clients told me, hey, you know what, Alan, there's a Chinese doctor that is coming to visit me, right? And so why don't you talk to him? I say, like, yes, I want to talk to him. And so sure we did. And we had that conversation and he told me that, hey, you know what? He gave me like 3 books to read, right? And he said, after when you're done with because I was renting boat in south of France, when you're done with the business, you can come, you visit me, give your treatment, and we'll talk. And sure enough, so the 3 books were one was called the Tao Te Ching, which is like a pretty intense Chinese philosophical book, right? And
Wow.
the other one was called the Hara, so Hara, which in Japanese means belly. That's why traditionally they will kill themselves with a knife at the center of
Mhm.
gravity of a human being. And there's a posture that comes with it. There's an entire philosophy, which I did appreciate a lot. And the third book was The Man Between the Earth and the Sky. So sure enough, I finished the season, see the guy, we start talking, give me a treatment. Of course, I asked about Chinese medicine. He told me, well, Alan, if you really want to know what you're doing, you need to go to China like I did, learn Chinese, be fluent in Chinese, and spend 10 years there. I say, oh, hold on one minute, I'm 30 years old.
That's a
I
long
mean,
that's a long time.
I mean, don't get me wrong. I love to travel, but 10 years in a country, and that was a task, right? And I thought it was too much. I wanted really to help people right now, right? I mean, obviously.
Right.
So I said, do you have any other option? And he looked at me, said, oh, you look strong. Why not chiropractic? And I said, what's that? So he gave me some information about French people who used to go to a different college in America to learn chiropractic. Sure enough, I got the information, from the school. I had that translated by one of my best friends. She was like an English teacher. That's how bad it was. Anyway, so we did that. And sure, what I love really, Sally, about that was like they were talking about the innate intelligence, your own ability to heal yourself. And for me, that was fascinating. It was really
Mm.
fascinating. And so what I did, I just, I bought an airfare and I show up at the school, literally show up. They didn't expected me. And lucky me, there was like a French girl there that was from my own town. And so she
Oh
really
my
helped me.
goodness.
I know, that's crazy. Huh? When you're lying, that's just crazy how things happen.
Hmm. Yeah, coincidences happen all the time when you're in alignment. Or
Yes.
some people think then it's not a coincidence.
I don't believe in chance and coincidence. I don't believe that
Mhm.
at all. Anyway, so so she gave me my first treatment, right? I even never had a treatment. And so I loved it. And they sent me to Kansas City, Missouri to do some prerequisite, which I did. I sold my boat business. And imagine I told my parents, remember they used to call me the gypsy, right? I mean, I was like partying every night. And so I told them, you know what? I'm going to America to become a doctor. So they said, oh, that's
They're
the
like,
last thing, Alan. Yeah. So they didn't know. I didn't really, it was hard for me really to tell them that I had that calling, right? I mean, I
right.
don't know. I never really expressed that to them. And sure enough, went to the US, graduate even earlier, actually. So I did a preceptorship with a chiropractor and things like that. And I met my wife that, of course, she was from France, right? We met in a bar in Kansas City. And after a few years, we got married and we have a daughter, right? And her name is Maya, right? She's 20 years old now. Anyway, so everything, I started to do chiropractic, but here's the thing, Sally. What happened is like I will get people good, right?
Mhm.
Better, should I say, and after they will plateau. And just to maintain the plateau, they will have to come to see me. So I said, there's something wrong here because there's one thing that I know 100%. 200%, should I say, right? There's one thing that I know 200% is when you've got a problem, it can be a health problem, a prosperity problem, a relationship problem. You need to know two things in order to fix it permanently, right? It means you can move on, you're done
Mhm.
with it, right? So,
Right.
number one, you need to find out what's causing it, right? I mean, if you don't know what's causing it, how are you going to fix it, right? And
Right.
after we said it, number two, you need to know how to fix it. So, to me, it means that the cause of a problem that was not what I've been told at school. Obviously,
Right.
right? Because I couldn't
Right.
really. My vision was really to help to empower people, should I say, to transform themselves, to grow to become the best version of themselves and myself, obviously, and to be, to have vibrant health also. So
Mm.
I was not too pleased with that. So I started to question myself and I said, why not checking the inflammation, which is chemical stress, the inflammation in the body, right? So I did learn a new technique. I was able to muscle test people, and the body will tell me which organs are under stress and what's causing the stress. So I was happy with that. Actually, I was so happy because my practice were, I think it went booming, right? I had 4 employees, was seeing 250 patients a week. I mean, that was like really living the American dream, right? I bought a house in the
Right.
best neighborhood and all that stuff. But here's the thing, my mind was always about work, 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 right? Because I thought I was doing the right thing. I was living my passion, my mission in life, right? So but here's the problem. It's like when I was coming home, for example, right? I was not there, but I was not present. So my relationship with
Right.
my wife, of course, went down the drain. And within a year, I ended up divorced. My practice, because after the divorce, and especially when you've got a kid, can be taxing, right? I mean, so I become
Right.
depressed and all that to deal with all the issue that my daughter, yeah, that I brought up to myself too, in a way, right? And so what happened? It's like so I couldn't focus very well. My clarity went down. I even lost some of my passion. Can you believe it? My
I
mission
do
in life
believe that.
got
Yeah.
disconnected from that. I mean, now that I
Hmm.
think about it, retro thinks about it, I'm just what the heck happened to me? Anyway, so my practice went from thriving to failing. I was by myself at the end at the office, the only survivor. And on top of that, really the cherry on the cake, I got diagnosed with early stage of colon cancer. So here I am, I'm just doing my own program. I'm helping people to avoid this kind of disease, to decrease the inflammation in the body. And up, I've got diagnosed with a second killer in this country. So I was like, I had to reinvent myself. I felt like to one point that I was like the phoenix that has to reborn from the ashes because it was like in so many different aspects of my life, in my health. So I really wanted Sally to find out, okay, what is the force behind it? Because I knew it was something within me. I just had the intuition, right? Because you can be a victim, like feel like a victim and blaming on the wife,
Hmm.
blaming on the circumstances, blaming on the entire world, right? But no, it
Right.
did. My dad used to be like this, right? And so yeah, I learned from him, right? And then I learned not to be a victim. So, and I also knew that by healing myself, I will be able to translate that to my patient. So that was a very good motivation for me, not only for myself, but also for something bigger than myself, right? And so that
Right.
was really important. And so sure enough, I started to remember you have to find the cause and you to have to fix it. That's my basic philosophy, right? And you'll be
Right.
surprised how important it is and how you can apply to so many things in life. It's just crazy.
It is. Sorry for the interruption. I just wanted to let you know about the Mind Matters weekly newsletter that is full of actionable tips to help you rewire your brain to live the life that you desire. Sign up for it at sallypederson.com. And when you do, you'll get the top 5 brain hacks for peak performance. Again, you can get it at sallypederson.com. Now back to the show.
It is. And I think that's what a lot of people are missing is because it's easy to go to a doctor and get a pill for something, get this or that, and it makes that pain, pressure, feeling, whatever go away. And people are like, "Oh, it's gone, I'm better." But the reality is a lot of those things are just masking the problem. So we're not feeling that back pain, headache, nauseousness, whatever it may be. And don't get me wrong, of course, I believe there is a time for medication, but that's not the first thing. And we need to figure out what is the problem because a lot of pills don't fix the problem. They mask the symptoms of the problem, and people think they're getting fixed. But once we go in and find out what the root problem really is, then we can go ahead and fix that. And as you said, I'm a true believer of in a lot of cases, I can't say everything, that the body can heal itself. I mean, we have formed from from an egg and a sperm cell. Like we formed from basically almost nothing to become human beings, and our body grew everything that we have and needed. And so I've always thought for so long is if our body has formed once, why can't it heal and fix things again? I mean, we break our arm. Sure, medicine, medical field, they put our arm in a cast. If we need, it's really bad, they'll put pins in it to hold it. But the bone heals itself. The tissues heal itself. And so we really should kind of look at what that cause is and how can the body try to heal itself first and then help along the way if we need to be doing that.
Yeah, and basically your body, all your cell in your body will change within a year. So you're a different person in a way as far as your physical and your physiology, therefore, within a year, right? And what I think, the conventional medicine, I call that, right? And so it's very good for emergency room, right? If I break a bone, like you said, hey, I want the good surgeon to realign the bone. It happened to me, trust me. I want him to realign the bone. I want the anesthesia and the painkiller. But, for long-term pain and stress, they are terrible. They are the third leading causes of death, according to their own stat, the American Medical Association. Their third leading causes of death are medical errors and drug side effects. So the way I always say I can debate a medical doctor in 2 minutes. And I will say, let's see, somebody's got arthritis and they're going to get a pill for the arthritis. So I'm going to ask him, so you mean the cause of the arthritis is the lack of pills? Because they didn't have a pill. You see how it sounds silly? It sounds even crazy. Say
Hmm.
what this French guy is saying, but that's truly what we have been told and what we have been believing, right? I mean, that's just crazy. Anyway, so I went on that quest and I thought to myself, okay, what is stress? Well, stress is physical, chemical stress, emotional, and mental stress. So if you truly want to be holistic, you have to be able to find out the cause on all of them and make sure that you know how to fix it, right? So I started with the physical. And as a chiropractor, we deal only with 20% of the nervous system, which is the nerves that exit to your side of your spine and go everywhere in your body. So I said, what about the other 80%, right? So sure enough, the cranial, right, is called the central nervous system, which is the brain and the spinal cord. And so I became a cranial specialist. I had, be able to help 100% of the nervous system. And Sally, I always have some insight. It's kind of weird because I treat people and some intuition I guess you can call that. I like to call that my insight. And I'm started to do things out of the blue, and I created my own energetical technique. So with physical, I was pretty pleased. Okay, that's fine. Now for the chemical, I knew already what was the cause, right? That was no problem. And now how to fix it. So what I did improve, I realized that if you supercharge your body with oxygen, it's like a miracle. And so it will kill all the bugs because, I mean, the bugs, the infectious agent, right? Should I say? So because they thrive on acidic condition, it will detoxify your body and more. So I had to find a cheap way to do it, right? Because if you do an alkaline diet, oh man, it's first of all, good luck of staying on that diet, number one. And number two,
Mm,
is going to cost you thousands of dollars a month. So I started to create mixture that were dirt cheap, and with a pH strip, the patient can monitor that,
mm,
yeah, that they become supercharged with oxygen. So I was pleased with that. I said, now, what are we going to do with the mental and the emotional? Because doing that, I was healing myself too, right? And but I knew also it was for my next program, my next transformation, right, for my patients, right, and my clients. So what I did, I started to learn emotional technique, and I will say, "Oh, you've got Sally, you got neck pain. You know why? Because there's that negative emotion that is bothering you. So I will muscle test that. But yes, you have to trust me that I was right, right? Nobody's 100% right, right? And so
right.
I was kind of, I knew intuitively, let's put it that way, that there was something better. And I started to research the mind, and what I found out was amazing. I was like mind blowing, if I can say that. That's what it was. Because when you start to, we all talk about mind body connection, right? We all are aware of this, right? But really, what
Mm,
it is. So we start by what is the mind. And I realized, Sally, that we're living actually in two separate worlds at the same time. So what the heck I'm saying, right? So what does it mean? It means that we've got the inner world and the outer world. So what is the
yeah.
outer world, right? So the outer world is called the conscious mind. Sally, it's your self-identity, it's who you think you are, it's your personality, what you're aware of, right? Your thought, your emotion, your behavior, your action, right? So that's the
Mm,
conscious mind. And after you've got the secret mind, the things that we're not aware of, the mysterious one. And I call that, it's really the unconscious, but I like to keep it things simple, as you may realize without conversation. Everything
yeah.
should be simple. And it's
Hmm.
subconscious mind, right? And the subconscious mind, Sally, just register everything you have been doing in your life. It's all there, right? Also, your skill as a podcaster, as a woman, as a mom, as a whatever you're doing, all your skills are stored there. Also, all the things, all the organ system that works that you cannot control if you want, like your
Mm,
heartbeat, your breathing, might happen automatically. That's the word I was looking for, right? And so this is also stored in the subconscious mind, right? And so now there's two things I have to share with you and the audience, right? The first thing is to show you how powerful that subconscious mind, that mysterious mind of ours is. So, number one, well, your conscious mind processes data at 11 bits per second. You say, okay. Well, the subconscious mind processes data at 11 millions bits per second, right? 1 million times faster. And the second one, that's the mind blowing one. When you realize that depends who you're reading, right? But when you realize that your conscious mind, who you think you are, Sally, your self identity, is only 5 or 10% of your mind, meaning
right.
that 90 to 95% of your mind is your subconscious mind,
Mm,
meaning that you use 5 or 10% of your mind and brain power, right? So obviously, what if we bring the subconscious mind to the party, right? Because you use 5 or 10%, you use your conscious mind, we focus only on the conscious mind for healing, transformation, and growth, right? What if we can use 100% our mind? Do you think it will be more powerful? What do you think?
absolutely.
Oh, God.
Absolutely. And I think a lot of people don't really realize that um, the choices that we make and everything is really a choice. And because I hear often and I heard it lots before with certain people, and everybody knows someone that when they talk about or they're around the person and they're like, "Oh yeah, well, it's just the way I am," or "It's just the way he or she is." And that's actually just not true. It's the way that they've conditioned themselves, and it's a choice because the way that they are like, as you said, those subconscious things, like we all breathe, we all our heartbeat, like our body does that, but everything else is conditioned into us, taught, remembered, experiences that we've had. And so to say that it's just the way somebody is when it comes to their personality and the choices they make, we now know that's just simply not true. And a person can change. Um, and not saying that it's easy, because especially the older we are, we've conditioned those things for many, many more years, but we can work on that and change that. And that's the conscious mind that we can change to make it more automatic and become unconscious or subconscious, or just, people have different words for it, but we can change it because it becomes automatic. We used to think of now how many things you can do at one time. You're driving a car, your kids are fighting in the back, you're telling them to be quiet, you're telling the dog to move over, you're changing this, like the radio. There's just so many things that are so automatic, or tying our shoes while we're having conversation. When we first learned either of those things, we really had to focus one thing and do it. Or if you've ever, there's been times that I'm thinking a lock combination, at the gym, had a great workout, exhausted. It's like, oh, what's that combination again? Thinking about it. And when you get to the lock, you just automatically do it without even thinking. Because when you were thinking about it, you couldn't remember the combination, but you just automatically have done it because it has become automatic because we've done things so many times. And that's how we can change that personality of who we are to who we want to be. We have to keep doing it and practicing and knowing that we can change it.
And the question comes, who are we? Are we only 5 or 10% of mind? Are we only our self-identity? And that's a big question. I would say, heck no. So this is a tiny part of who we are, right? But
Mhm.
here's the problem, that subconscious mind can be programmed, right? And
Yes.
especially from age 0 to 6 to 8 years old, right? We are more like sponges, right? And so
Mm,
we absorb everything and we assume that what we see outside is the truth. We assume that this is for the own good because we are so
right.
innocent, right? So we
Right.
assume that, and when we assume more and more, this become a program. And you've got
Right.
two kind of programs, Sally, right? You've got a program that are serving you, right? It's kind of your mind working for you, right? Or you've got some programs that are not serving you any longer. So it's kind of your
Mm,
mind is working against you. So the one that are not serving you any longer, we call that limiting belief. Limiting belief. And the one that are working for you, we call that empowering belief, right? Empowering belief. So let me illustrate that with an example. I think it will
okay.
be better for everybody, right? So let's pretend there's a little girl that see her dad drunk every night, coming back home and beat up his wife, right?
Mm.
So here's the question: what do you think that little girl's gonna attract down the road as a romantic relationship?
A man that drinks a lot and who is physical towards her.
Now, here's there are two things that comes up, right? When I thought about it, I say, I agree. Maybe probably 80%, 90% of the people will agree, right? Okay. So, number one, when you ask that woman now, right, that she's
Mm,
on that abusive relationship, when you ask her, do you enjoy to get beat up like your mom? She's going to say, heck no. So the conscious mind is going to say no, but the subconscious mind has been programmed as men are predators and women are prey, right? And you've got that program running, behind the scene constantly, all the time,
mm,
like a loop, right? So now the second question, how she's gonna attract that guy? Is she's gonna see a guy and then shake his hand and say, are you ready to beat me up? I don't think so, right? So it's kind of our subconscious mind are connected. Right? When we
right.
say we are all one, doesn't mean, by the way, that we all have to love each other, right? But we are connected somehow. I truly believe that's through our
Mm,
subconscious. And the subconscious mind is going to tell her, because, you know, she's, what I want to say, it's nobody's fault, right? It's not her fault that, you know, it's not a lack of willpower. When you've got a program like this, you know, good luck, right? It's
Right.
you cannot override it like this, right? Because
Mm.
if you use 5 or 10% of your mind to resolve 90 to 95% of your problem originated with 90 and 95% of your mind, good luck. I mean,
Mm.
that's not the odds are against you, right? And that's a problem.
Right.
That's the problem
Right.
we're having, right? And so the way it's going to happen, that subconscious mind of hers is going to say, this guy, you're going to fall in love with him, right? It's like the subconscious mind can read the other subconscious mind. And the other guy probably has been bullied. And now he's a bully, right? And so they're going to pair
Mm.
up and they're going to start to, because that his subconscious mind is going to do the same thing, and they're gonna have that attraction, right? And they're going to start to tango and dance together, right? And so there's three case scenario that mainly that can happen.
Mhm.
All right, Sally. Case scenario number one: she may get married with a guy and get stuck in that abusive relationship. We all know people like that, I'm sure, for
Right.
the rest of her life, right?
Hmm.
Number two, she may get involved with that guy and after, you know, get tired of it, obviously, of the abusive, and get another guy, maybe kids along the way, right? Lots of suffering for sure.
Mm.
And there's two state of awareness, if I may say. The first one, that, I mean, I had lots of women telling me that. And they will tell me, oh man, I'm done with men. It's over. They're not good for me. You know, I'm done with relationship. This is not working for me, right? So they still have an awareness, realizing that it's not good for them, right?
Mm.
But it's not true healing. True healing will be that she's going to attract a totally opposite man, right? A man that is kind, nurturing, that is very supportive, that see her as an equal. So when, you know, because we can learn from life experiences, right? It just take a long
Absolutely.
time sometimes. It's just, you know,
Hmm.
sometimes we never learn, so there's no guarantee. And the case, finally, the case scenario number three, she can see somebody that just can't be able to reprogram that subconscious mind, right? And so that's what the mind clearing, the technique I created, can do, right? We can actually, there's three steps, you know. The first step, it's like when you've got a program, right? Well, let's pretend the mind is a computer, because I think people will understand better. So
Hmm.
let's pretend that the brain is the hard drive, because I
Right.
even wrote a book about the brain, is the brain power secrets. But your thoughts are not in your brain. I guarantee you that, right? So that's, and your emotion, and that's different layer around your body, a
Right.
different electromagnetic field, right? And so the brain is like an interface, right? So it's your hard drive. Now your software is your subconscious mind. And after the output of your software, it's your conscious mind. And after your behavior, it's like in the screen of life. So if you've got a good quality software, meaning not too many limiting belief, right? You're gonna love your life. You're gonna love your screen of life. I say, oh, life is fun. You know, I'm doing this and that. But if you do have lots of limiting beliefs, you have lots of challenges, you know, traumas, and whatever life brought upon you, right? You've got lots of limiting belief, and so what happened? Well, the screen of life, it's not going to be too pleasant, right? Does it make sense to you?
Yeah, absolutely. Absolutely. And I think too, people, it's knowing that um there are those three, and that we can change. And knowing again, it's not going to be easy. Some things are easier than others. And I think too, it's breaking it down into manageable steps. And I'll use the example of New Year's. Right? New Year's, people are like, I'm going to change my life. I'm going to go on a diet. I'm going to lose weight. I'm going to go to the gym. I'm going to stop eating like, and they have the whole list of things that they're going to do. And that's great that we want to make changes. But I also think that people kind of overdo it a little bit. And so the way that I like to do things is if you have that list, pick one thing off it and say, okay, for the next month, to just make it easy, I'm going to focus on this one thing. And maybe it is exercise, or it's going to be drinking more water, or it's going to be quitting smoking, or whatever the things are, because I find then it's a little bit easier to do it step by step instead of all of a sudden waking up one day and saying, absolutely 20% of everything that you're used to doing is no longer going to be done, and you're going to completely be doing other things. And it's really hard to keep that going long term. And some people do it. I mean, I know that there's some people that do it, but I think that's why by week 3, most people have said, yeah, that just, I'm not going to the gym anymore. I'm too busy, or, whatever the reasons that they have, that they're no longer doing any of them. And it's not even just cut back. It's they've gone back to their reprogramming self that they do, and then they do it all over again next January and next
Yeah,
January.
Pardon the interruption. If you're liking the show so far, please like and subscribe and hit that notification bell. It really means a lot to me. It helps grow the show and the channel and to the show.
Next
yeah,
January.
exactly. So, again, that's using your conscious mind.
Yes.
Right? So you're using basically 5 or 10% of your willpower, 5 or 10% of your brain power and your mind power, right? That's the hard way. That's what I've been taught to do. And don't get me wrong, I think it's a good plan that having and putting like different steps and all that. But it's still, using your subconscious mind. Because the problem with people not doing things, it's like they're not aligned. So what do I mean? Imagine there's a triangle, right?
Mm-hmm.
And inside the triangle, you've got limiting belief, right? So on top of your triangle, what's going to end up? You're going to have negative thought, right? So limiting belief, right? On the right base, you're going to have overwhelming emotion. That's going to match that thought. And after, on the left side of the base of the triangle, you're going to have non-desirable behavior, and so an unproductive action. So it's not going to work. Right? Let me give you an example. If let's pretend my dad told me, "You're a loser, son." Okay, so I believe it, right? He told me so many times. So my limiting belief is I'm a loser. I'm going to think I'm a loser. I'm going to feel like a loser. I'm going to behave like a loser. I'm going to have loser outcome, right? Which is going to reinforce that, make me feel even more like I'm a loser, right? Which I'm going to think, man, I knew I'm a loser, but that's much. That's a lot. So I call that the subconscious stress loop. And we caught up on that each time, that's why the program are running all the time. So each time is going to go. So we need to break that loop, right? So how can we do that? Well, we're limiting with mind clearing, there's 3 steps. It's very simple, because what I feel in my field is like we are not talking the same language, but the subconscious mind. Because people are going to tell you, oh, you need to journal, you need to do lots of repetition and all that. So it's the equivalent. Let's imagine we're on a podcast right now, right? We've got a video, we've got a microphone, right, Sally? So let's pretend no more sound. Right? Our Mac doesn't work. So I'm going to try to communicate with sign language, maybe write down some stuff. That's not going to be the easy way, right? And what about the depth of a conversation, right? How far can we go that way? So with the mind clearing, we've got everything on. We've got the video, we've got the audio, and we can rock and roll. And you can communicate with your subconscious mind, right? And so how do we do that? Well, remember dreams. That's how dreams, it's our subconscious mind talking to us, right? So the dreams, what happened? What do you remember of a dream? There's always a pictures of the series of a picture. Never had anybody, oh, Dr. Salas, what I remember from my dream is like the sound of it or the smell of it, right? I mean, it's just not possible. So the communication, that's why they can store so many data, because it's a picture. Your subconscious mind processes that with picture. That's why it's just so much more powerful. A picture is worth 1,000 words, right? And so, and there's the symbolism, the archetype, according to Carl Jung, that are there. Which even with words, you cannot express that, right? It's not possible. So what I will ask you, let's see, you told me, because, in my field, they don't talk about pain, or they don't talk about symptom and limiting belief. And what I realized, it's like, yeah, there's limiting belief created by pain, and are the source and the cause of your pain too, right? I mean, to make sure that people understand, let's pretend I've got pain for 10 years. I've been trying to see everybody to fix it. Nobody can fix me. It never lasts, right? You think it's going to affect my mind?
Yeah,
You better believe
absolutely.
so. So this only what, but what I discover, some cause of a pain can be directly attributed to subconscious mind. That's crazy. So it
Mm-hmm.
means your subconscious mind, your limiting belief can create pain in your body, can create symptom in your body, can create anything, right? And so in my field, you don't hear about people treating pain with that. I don't know anybody who does that, right?
Right.
Maybe I'm ignorant, maybe I don't know other people, which is a possibility. I don't know. So I use pain a lot because that's how I did improve the technique. That's how I had immediate feedback because the pain is there or it's not, right? I mean, you cannot
Right. Yeah.
lie out of pain, cheat out of pain. I mean, it's there or it's not, and it's instant feedback. So you will come to see me and you say, oh man, I've got neck pain, I've got headaches, right? I've heard that, hey, maybe it can come from my mind. So can you help me? So I will tell you, okay, what we're going to do, Sally, you're going to visualize, right? Remember,
Mhm.
you're going to visualize the worst pain that you experience in your neck, right? And that
Okay.
picture, that's going to be your limiting belief. We don't need to find out what it is. You don't need to use your analytical mind, which is 5 or 10% of your mind, to crack the code of something that is so much more powerful. Does it make sense?
Yeah, absolutely.
So you're gonna visualize that, right?
Yeah.
And after we're gonna not me, you're gonna send a customized program. I'm gonna help you, guide you for that customized program, but you're gonna send it to yourself in that picture, right? And so that's called step number one, deleting the limiting belief. Number two, when
Hmm.
you've got a program that doesn't work, you delete the program, and what you do, you replace by a one that's going to work for you, right? So after
Right.
I'm going to tell you, Sally, you know what to do? You're going to visualize the opposite of that picture, right? And you have to love it, right? As much as you can. And that's going to be the empowering belief. That's how we're going to reprogram your subconscious mind with that picture. Again, to download that, it's going to be a customized download, to you.
Mhm.
And you are going to do that. So look, this technology is empowering you to heal yourself. Again, remember at the beginning of my journey, for me, the innate intelligence, it was so important. So I'm just a guide. I'm just helping you. You are using, I give you the technology to use your own ability to heal yourself. This is the holy grail of healing in my book. There's no better than that. Because you don't
Right.
have to believe me, you don't have to trust me, you don't have to do nothing. That's your own picture. And by the way, your negative picture is not my business. I will
Right.
never ask any things about the negative picture. Somebody, maybe I killed someone and want to get rid of that, and doesn't want to tell me even that, what happened. It doesn't matter. It doesn't matter. We still can help. For the positive picture, sometimes, if they have trouble, I will ask them some question. But the key here is like whatever the first picture that come to your mind is always the best one because it's less filtered by your consciousness. Right? That's
Right.
it. So we do that. And number
Absolutely.
three is so important. You want to create that on your screen of life, remember? You want to
Hmm.
manifest, you want to love that screen of light. So there's another program that we do just to download that in your screen of life. And after, let's do it. So now the kind of result that you can go on my website, there's testimonial of that. Um, I will say 80% of the patient, 1 or 2 visits, right? Because you can have after resistance of healing, meaning that you tell me, oh, my neck is good now. First visit, right? Which is not unusual at all. So I don't have
Hmm.
pain in my neck, but suddenly the next day you go to your computer and blah, oh man, I've got my pain coming back. You go into your car and you've got the pain coming back. So those are called that resistance for healing. So guess what we're going to do the next visit? We're going to do mind clearing on those two situations. And after, that's it, we're gone. So it's not like, because some people and some hypnotherapists told me that, so it didn't work. I said, no, when you deprogram, it's like over triggers that I call resistance or healing that shows up in
Mm.
your life. And it's easy to get rid of. It goes actually much faster. And that's it.
Right. Well, that's amazing, and it works well. So if people wanted to get a hold of you, they're interested in your programs, where can they find you? And then you also said that you've written a book. So where can they find your
Yeah,
book if it's still available?
yeah. The book was years ago when I started
Okay.
to study, the brain and the connection with the gut and things like that. So it's not really about that. So there's a book coming.
Okay, let's talk about that
It's
one then.
but that's you already have a big part of it, and I created a philosophy with a head, heart, and the hara. Remember we talked about that at
Yeah.
the beginning, and so to make sure that our thoughts are aligned and so many different things that come from that philosophy. Anyway, if you want, so the first things, doctor means teacher, right? And so
Right.
what you go to my website, there's a ton of information, right? The website is themindclearing.com, themindclearing.com. And if you want to contact me, you go to contact, right?
Mhm.
And there's a form here you can fill in, or there's an email. Now, because of Sally, right, I give 20% on treatment because you want to experience it, right? True knowledge is about experiencing things. Otherwise it's a fantasy in your head. But after when you experience it, you can say, oh yeah, I I didn't realize how powerful I was, right?
Right.
Because that's the thing, how powerful you are. And if you want to learn it from yourself, for yourself, like if you're a lay people, because I knew that will be for everybody, right? So if you've
Mm.
got like a lay person and want to transform yourself and all that, I've got a program, right? And if there's the mind clearing, the body
Mhm.
clearing is like for pain, symptom, inflammation in your body, right? Customized to it.
Mhm.
And after the goal and success clearing, obviously to to reach your ability, right? To reach your full potential. And with free program, I give 50% off on the entire program, right? Because I want people to
Right.
learn. In the vision is like imagine in every town or major city or whatever. Not only there's people who can help themselves, but also help their loved one. Remember, the third killer in this country is the long-term pain and stress. You can help with that, and they can help them for healing purposes. You don't need to have no background on that. You don't. It's just you become a deprogrammer if you want, right? And it's very simple. It's not complicated.
Right.
So not only you can help yourself, you empower yourself to heal yourself, but also to help your loved one, right? A family member
Mm.
who's got low back pain, a family member that's got a codependent relationship that is open to that, and you can help them. But also it's like for coaches and health professionals, right? That really want to go deep and be serious about this is it. If you're not serious about really getting result quickly and as deep as you want, don't learn my technique. If you want to keep patient forever, don't learn that technique. Because that's to me, that's not what this is about. It's really empowering other people to do that. And
Okay.
ultimately, imagine they are in different town and they can help people for their health, relationship. By the way, it's all connected. When
It
we
is.
reprogram positively, on your pain, for example, right? That's going to also help your relationship. It's going to also help your body because that's treating your mind as a whole. So I'm like you can tell, I'm super duper excited about that because I mean, for me, this is it. This is empowering people. It's amazing.
It really is. And I want to thank you very much for your time today. I will make sure that the links to your website is in the show notes. And so it makes it easy for people to connect with you. So again, thank you very much.
Thank you, Sally. It was a pleasure. Thank you for your input.